And for the people who are trying to do this, you have to click on your camera or mic, and the message will show up for you to accept the recording.
Thank you. I haven't been on the receiving end of it.
Yeah, I just noticed it when I couldn't find
Just
any
the
or see
recorder.
anything. So yeah.
It's a new feature, I think, in the last 24 hours.
So if you are back in, if you can give a thumbs up or some sort of like virtual reaction, that would be good. So that way we know that everybody's back. Thank you, technology, right, for all the all the things. Okay, folk, I first of all welcome everyone to the February meeting of the Health Equity Technical Advisory Committee. And I'm Manny Santiago, Chief of Equity and Community Partnerships at the Exchange. I use any pronouns, and I'm the facilitator for the meeting. A couple of things with today's meetings. One is that, as you already heard, we're using this new technology and making sure that we have not only recording but also transcript. Excuse me. A quick note about that, and is that we're using artificial intelligence, which is not always so intelligent. So for people like me who have accents, sometimes the transcript doesn't really capture the actual, conversation. So sometimes you might need to do a little bit of guesswork on some concepts or some sentences or whatnot. So keep that in mind. I always like saying that because not everybody knows, or not everybody, or people just expect that because it's intelligence is really, super intelligent and doesn't make any mistakes, but that's not the truth. The other thing that I want to say is that I am in DC, as someone already mentioned. Oh, Wayne mentioned, meeting in conferences and meetings. I leave tomorrow morning, and excuse me. So I'm different time zone and all that, and have been up very early doing a bunch of things, including meeting with one of our congressional delegates. So my apologies if I seem a little bit with less energy than usual, but it's been a long week already. The other thing is that we're gonna go through the agenda real quick. If Jen, if you can share the next screen, the next slide, please. And I want to also shout out to Jen Manus, who is our tech, our assistant today. She's she's the administrative assistant for my team and the communications team, and she will be helping us today for this. So, folk, because I'm on my screen, I mean on my laptop, that means that I only have one screen, and I need to read the names of the people and check the quorum. So I'm not gonna see you. So please unmute you when I call your name if you're here, so I can make sure that I recognize your presence. And I'm gonna go through the list. As I said, we have two people who are not going to be here, and they already sent a note that they will not be here. So I'm gonna go through the list and see if the rest of you were able to make it. So with that, Julie Becker, I saw you, but you still there?
Hi. Yeah, I'm
Thank
here.
you. Thank you. Ashley Bennett. Ashley?
Yes, I'm here.
Thank you. Again, I don't see you because I have my only one screen and I have my list here on the screen. So, Jesus Benavides. Jesus? Okay. Brandon is out today. Sagang is out. Neither one of them could make it today. Patricia Jeppert, I think I saw you, right?
Yes, I'm here. Hi, Manny.
Hey. Hi. Diana Greenway.
Here.
Thank you, Diana. Miranda, I think that you were also there. I saw you, right?
Yes, I'm here.
Yes. Lichi, I saw you.
Yep, here.
Thank you. Carlinda Jabalan. Carlinda? Okay, and Erin? I didn't see her. Erin Lopez, Erin Klika, sorry. Okay, I think that we are missing 4 people. We still have quorum for conducting business, so that's good. Okay, folk, let's go over the agenda real quick. I'm gonna share with you a quick recap of, um, from last time and where we are with some of the recommendations that you offered us. We'll hear from our policy shop on the privacy concerns and racial and ethnic data collection. We have Christine. Oh, my God. Sorry, a second, I lost here my view. Okay, I'm back. Okay, we'll have a quick update from our policy shop, as I said, on data collection. We'll talk about coverage expansion, specifically about the waiver that many of you know that we have, and some contingency plans for in case that it's revoked. And then we will have one big group discussion. I think that because of the theme and because of the things that are happening in our federal authorizing environment, I thought that it would be a good thing to have an open discussion amongst all of us instead of going into small group discussions. So today will be a more open conversation amongst all of us, okay? And then we'll stop for public comment before closing with any final questions and concerns that the committee might want to bring forward. With that, let me give you a quick update on since the last time that we met in December. Last time we took the time to just talk about what our communities were feeling after the election results and the upcoming new administration, federal administration. Many of you shared some of the concerns and the things that you had been hearing from your communities about the incoming administration that is now in place. And we know that some of the concerns continue to be there. I would encourage all of you to reach out to my team and to myself. And if you want to share anything else, if you want me to come and sit down with your teams or your community groups and talk about what is happening and how it's impacting the services that we provide and the access that we provide to healthcare plans, please feel free to reach out. I'm more than happy to either virtually or in person have conversations with the groups that you think would be appropriate to have these conversations. I'm more than happy to have those conversations and to listen to the community and see how we can partner with you to ensure that we continue being a safe place where people can access health coverage. Okay. The other thing that we discussed were 2 equity initiatives. One, accessibility with Melissa Petty, and she has taken all of your considerations and all of your suggestions into consideration and been working on on the accessibility plan. So thank you so much for giving feedback to Melissa on all those things. And the other thing that you heard from Jasper Marino, our DI manager, and it was more than asking for feedback. They were sharing with us their plan, their health equity plan, their equity plan for the agency. And I'm happy to share with all of you that the equity strategic plan has been already rolled out and is already internally in our system to share with the whole staff. And earlier today, Jasper had the opportunity to share with all of the staff some highlights about the plan and how the plan is going to be implemented. So things are happening, and thank you so much for engaging in those conversations before. Does anyone have any updates or anything or any questions about that recap or the things that we talked about last time? Hey, I don't hear anything. So with that, Christine, are you here? I think I saw you, right?
I am. Hi.
There you are. I want to bring Christine Villas with our policy shop, and she will take the next section. Go ahead, Christine.
Thank you so much, Manny. Good afternoon, all. I am Kristen Vias, Senior Policy Analyst here at the Exchange, and I use she, her pronouns. And thanks for letting me be here for a couple minutes to get your feedback on something. And we can move to the next slide, please. So some background. 3 years ago, we gave carriers a requirement to have directly collected race and ethnicity data on 80% of their enrollees when they submit quality reports to us by the summer of 2025. And so we said that we would help them by sending any data we receive through the application when folks apply on Health Plan Finder to them. And this 80% target is one that was really championed by industry leaders, especially in terms of things like healthcare quality. And our goal in wanting this data is to be able to do analyses for different equity efforts. And there's so much we can do with this information. Just one example is we receive quality reporting from the carriers every year that shows screening rates for different preventive care. So if we could be able to stratify this by race and ethnicity, then we could see where are those care gaps in some populations we need to close so that the providers and plans could work together to do more targeted outreach to those folks. So the good news is our data collection over this 3-year period has gotten much better. So the graph you see is where we landed at the open enrollment that just wrapped up. And some of our carriers, so this is just overall, but some of our carriers have hit or exceeded the 80%. And in some cases, they're supplementing it with data they collect from other sources. But as you can see, there's still work to do, especially on ethnicity data collection. Also, when we've done analysis, we've seen this is a running trend for a couple of years, where if a customer works with a broker, they're less likely to answer this question on their application. And so we're trying different mechanisms to improve this collection, because really the easiest way is if we just get it at application, as opposed to trying to do it later on the back end. So for example, sometimes carriers, especially the ones that provide patient care like a Kaiser Permanente, could get it through electronic health records. But the easiest way is that application. So we have a proposal that we just wanted to get your feedback on. And if we could please move to the next slide. And so one way that could help support these efforts at the point of application, this suggestion came from one of our carriers, and we wanted to stakeholder it with all of you to get your perspective and expertise. And so what you see on the left is, so Health Plan Finder gives a little explanation about why we're asking customers for their race and ethnicity. And so the language you see on the right, the information that is bolded and underlined, is language that a carrier suggested we add. And they said they think that in some cases customers are hesitant to answer this because they're not sure how this information is going to be used and if this information about them is going to be protected. And so a couple of questions where I'd love to get your feedback is, first, do you think customers are concerned about privacy of these questions? And do you think there's a need to update this language? And if you think yes, it would be good to update it, what are your thoughts on this suggested language and any other suggested changes you have that would make customers, feel more comfortable answering this question? And I see a hand there.
Sorry I'm late. People are very scared right now. So one of the things that we've heard coming back is folks are scared to even have their information in financial institutions for fear of being targeted. And that's broad across different groups. That's people who are immigrants, that's people who are LGBTQ, that's women. So we're seeing a lot of fear around data privacy. So I think anything you can do around data privacy would be good.
Great. Thank you so much for that perspective. And I think the next hand I saw was Miranda's.
Yeah, echoing the thoughts that were just shared, we at Primera, we hear back from our members that kind of skeptical. Why are you asking for this? Why do you need it? And so the more, I think our language looks pretty similar to what you have up on the screen. I think the more specific we can be about how we're going to use the information, the better. I think that's one area that we've struggled right now. Internally, we're kind of just keeping the data locked down as much as possible, and it's, you know, in a really secure spot. And we're creating kind of data governance and policies around what's an acceptable use of the data versus not. So we're not even really at the point where we are using it. And so it creates this kind of tricky space with our members of like, we know what our intent, like kind of the general intent is, but without the specificity, it feels a little bit vague. So sometimes I fear that we're putting the cart before the horse a little bit. So yeah, I think if there's as specific as you can be, knowing that you might not know everything right now,
Right.
is good. Yeah.
Yeah. So what I'm hearing there is that it, like any kind of maybe concrete examples that a layperson could understand of how we'd be using the information would be helpful. And I also just
Exactly.
saw, great. And then I also just saw a link about FAQs. Thank you for that. Lychee.
Hi, yeah, I agree that people are scared and agree also that clearly conveying and strengthening protections would be helpful. Frankly, given the climate nationally, intent is not good enough. And so concrete examples would be helpful. This slide could be read as suggesting HBE has access to health information. I know that's probably not your intention, but I feel like it's not entirely clear. If you're not using information to make decisions about benefit coverage, it raises the questions of how the information you have will actually improve equity. It might also be more technically accurate to insert individual before decisions, because my understanding is deciding to address health disparities will actually potentially shape benefit coverage in the future.
Thank you. I'm just taking some notes here. This is all really great feedback. And it sounds like too, this language could use a little bit of cleaning up just about what information we do and don't have access to as to not cause additional concerns from folks. Anything else?
Your chance, excuse me, folks, to give us some concrete suggestions on how to improve our communication to our customers to ensure that they feel safe when we collect data, because we want to have good data.
Yeah, and I also know sometimes like it's like good to go and think and digest about something. So I'm gonna go ahead and put my email address in the chat. So if in the next couple weeks you have any more thoughts about updates that would be helpful, please email me.
Thank you, Christine. I was
Not
actually going to suggest to do that, so you beat me to it. Thank you.
excellent. Well, thank you all so much for the time today. Really appreciate your feedback and your insights, and I will turn it back to Manny.
Thank you. Excuse me. So now we're going to move to another conversation, another very important conversation. And I know that my buddy here, Joan, has been going around meeting with community members, with different stakeholder groups to get feedback on some of our contingency plans in case that our waiver, the 1332 waiver, is revoked. I also want to make a comment here as the Chief of Equity and Community Partnerships. I think that it's very important not only to engage in this conversation, so I really invite you to pay attention to what Joan is going to be sharing with us, but I also want to recognize that we don't want to call too much attention to the work that we're doing, lest the federal government moves faster than we could, that we wish it did, to remove and revoke the waiver. So these are really uh, strategic conversations that we want to have with community partners, while at the same time trying to stay away from the federal government's radar. And I just want to make that clear. We want to engage the community in these conversations while also recognizing that we don't want to call too much attention to it. So we want so we can have some more time to ensure that we have not only good plans in case that is revoked, but also in case that the federal government doesn't note that we have the waiver. We don't know what is happening in the transition sometimes. We don't know what might happen at Health and Human Services. We don't know what might happen at the Center for Medicaid and Medicare. So we want to make sure that we engage, while at the same time, like off the radar from the federal government, so we can continue providing a space, a safe space for undocumented residents in Washington to access healthcare coverage. So with that, I'm going to pass it on to you, Joan, to give us this presentation and engage in this conversation. And the other note that I want to make is that after Jones does the presentation, let's wait for her to go through the whole presentation, and then immediately after we'll get into questions and a discussion. So it is not going to be breakout sessions. So after Jones' presentation, we can you're welcome to ask her any clarifying questions and start, offering any feedback and engaging in conversation. So with that, Joan, it's all yours.
Thanks, Manny. Hi, everyone. Good afternoon. My name is Joan Altman. I am in the policy shop with Kristen and others at the Exchange. I direct our coverage strategies and expansion portfolio, which I am affectionately referring to as everything currently at risk of potentially being rolled back by the incoming administration. So today I'm talking about our federal waiver. There's some information in the appendix about some other things that we're watching, notably a recent Deferred Action Childhood Arrivals rule that granted people who are DACA recipients federal subsidies. Watching and monitoring to see if that rule might get reversed. We're also closely watching and monitoring potential changes at the federal level that would impact coverage and eligibility for not just the waiver, but also in partnership with our colleagues over at Medicaid, looking at potential Medicaid changes that would require health plan finder changes and other broader based changes that could impact some of the anti-discrimination policies and other protections that are currently in place that could impact our customers. So it's a busy time, but I will say in a silver lining way that the work of members of this committee and members of the community, particularly Health Equity for Immigrants Campaign and others across the state, have engaged in as trusted messengers to help share information about our waiver and the coverage that's now available through the recent expansion programs has not gone unnoticed. And even in this current political climate, I will say that our enrollment in the qualified health plan expansion through this waiver doubled. That was after the election. So we have seen over 1,000 new people sign up for coverage. We know there's fear and concern about potentially using that coverage in the current environment, but will say that as a backstop for people who wanted peace of mind of having coverage should something happen, and or who needed health coverage for current pharmaceutical needs and medical needs. We did see people continue to come in and sign up and enroll. And I know that's a testament to the good work of people sitting in this virtual room who are on the ground working with folks. And because of the trusted messengers we've had, our reach has continued to expand in year 2 of the program. So just wanted to acknowledge and thank everyone for that. Okay, so stepping all the way back, this has been a labor of love for a number of years now. The exchange was approved for our first in kind federal waiver back at the end of 2022 that we implemented in 2023 for coverage starting in 2024. And the waiver waives the part of the Affordable Care Act that says if you're undocumented, you cannot get a qualified health plan through the exchange. So we waived that provision. So now everybody, regardless of their immigration status, can come through Health Plan Finder, get a qualified health plan. And if you're income eligible, you qualify for state assistance when state assistance is available. We'll be putting out some data where we may not be publishing it, but we will certainly be distributing it to this group and others, showing the numbers I just mentioned. Close to 2,500 people have signed up, over 1,000 new, over 1,000 who are income eligible for the Apple Health expansion. That program's been capped, but they have come over to our side of the pond and signed up for qualified health plan coverage. The waiver is approved through the end of 2028, but there are some mechanisms the federal government could use to either amend the waiver in a way that we would find unpalatable and consider an effective termination. Like if, for example, an attempt was made to amend the waiver to require transmittal of personal information, which we don't currently transmit in any way to the federal government. That would be, we would consider that an effective termination of the waiver. And there are also some other means that they could use to end the waiver. So we're doing contingency planning. We're hoping that they don't, but in the event that they do, we've been working sort of across sectors, tribes, governor's office, attorney general's office, state agency partners, carriers, community partners to explore how we could maintain a coverage pathway for those folks who are currently seeking coverage under the waiver, and going forward, people who may newly want coverage. Jen, let's go to the next. Okay, so as we've been approaching this exercise, we've had some guiding principles that have been sort of steering our efforts. The first has been that we want to maintain the current 1332 waiver as long as possible. I think, this coverage pathway was preferred because it completely masks your privacy, because it allows families to enroll together through the same front door, because of the seamless integration with our Apple Health expansion program, and other Medicaid state-only available programs. So lots of reasons that we sort of initially went down this path. So hoping to extend the life of the waiver as long as possible, even if the feds were to express an interest in pulling back the waiver. There are some timelines built into our current contract with the federal government that, if they were abided by, would provide some heads up and some runtime to implement something new. We also have heard repeatedly from community from the minute we engaged community about pursuing this waiver, about the importance of privacy. I think I've already heard it mentioned here several times today. So wanting to maintain privacy for our IHC customers under our current program design. Carriers do not know somebody's status. The federal government does not know somebody's status. And I think for everyone who's provided feedback on the program, folks tend to like it that way. We're hoping to avoid a mid-year coverage disruption if possible. So, we would hope that if the federal government initiated discussions about withdrawing the waiver, that there could be an avenue to extend the life of the waiver, particularly for the people who already have coverage through the end of plan year 2025. That would certainly be our goal. We would hate to see mid-year disruption with so many people already in and getting coverage under the waiver. And finally, this current coverage pathway we have through Health Plan Finder that provides access to state subsidies. We'd like to see an avenue and a way to maintain coverage and maintain access to the state subsidies continue. So I included discussion questions throughout. I guess now they're sort of teasers for later, Manny, if we want to take them at the end, but something to sort of reflect on as we're moving through are these the right guiding principles? Are there additional guiding principles that should be prioritized? What, if anything, did we miss here? Welcome feedback in chat and later as we discuss as a group. Jen, let's head to the next. I think there are 3 areas of alternative coverage pathways that we've been broadly considering. I will say there are lots of strands we've been chasing down under each of these headings. And I just want to thank and acknowledge our colleagues at Healthcare Authority, our colleagues at the Office of the Insurance Commissioner. They have sort of been diligently working with us to track the viability and feasibility of implementing an alternative the state implementing an alternative coverage pathway that could be implemented relatively quickly should the waiver get pulled. So there's sort of 3 categories that we've been looking at. The first would be kind of leveraging off exchange plans. People can go to carriers directly and buy a health plan. It's a relatively small number of people who do that today, but we know members of the undocumented community, that's one way folks are accessing plans. That's how folks were accessing plans before we got the waiver. So, have looked in working primarily with OIC about what a model that leverages that type of pathway would look like. We've also worked with our colleagues over at the Healthcare Authority on what it could look like to leverage some of the existing Medicaid programs. The Apple Health Expansion obviously is a program that serves a similar population. So what would it look like to implement or leverage MCO contracts to provide a coverage pathway? And finally, what is the most readily available in the short term, it seems to date, is looking at a new state-specific, population-specific program that could leverage Health Plan Finder and continue to leverage Health Plan Finder, but would sort of and continue to screen people for available Washington Apple Health programs, but would sort of be able to facilitate people who are undocumented into a new state coverage program with coverage and benefits that would look similar to the qualified health plan coverage they get today. So those are the 3 broad-based groupings. We do think there are some mechanisms that we can continue to drive to ground that are viable, which is encouraging. I think the caution here is both in speaking something to existence and also being aware of some of the federal risks that Manny mentioned at the top of the hour. I will say that I've been in a lot of community forums talking about this in depth, and to the extent that there's an additional forum that folks would be interested in hearing from us in, we are sort of preferring to do meetings verbally, but happy to address questions and additional details that folks may be interested in. Jen, let's keep on trekking. So what have we been doing? We have a lot of examples of state-only coverage programs for people who are undocumented, both on the Medicaid side of the house and leveraging state-based exchanges. So we've been talking to our peers in other states, Colorado, New York, to name a few, and DC and Massachusetts, others. Anyway, there's a handful of states that have coverage programs that extend coverage to people who are undocumented, and they've taken time to meet with us and talk through what their process has been in establishing state-specific programs. We've been actively involved with the governor's office and the attorney general's office in looking at further safeguards that could further ensure privacy of our data. Similar to the comments made earlier about robust privacy protections, the exchange obviously has federally protected tax information. We have one of the most robust privacy security sort of apparatuses in the game. We also established specific privacy protections as it relates to the immigrant population and people who'd be accessing coverage under the waiver. We have very limited and tight access to that data, and it's masked to everyone, generally speaking, externally. So we've been looking at in what ways we could strengthen our state level protections should there be interest at the federal level in accessing some of that data, and those conversations are ongoing. We've also been hearing a lot about the fear and uncertainty in community around use of this data and use of this information, and have been developing materials with that in mind and to address those specific concerns. So I think we'll come back to this question. I'm hopeful in the group discussion, but similar to the prior presentation, hearing from you all what else we can and should be doing in our little sliver of the world here, which is having people sort of access health insurance in this current broader climate. Any advice and input is welcome, particularly as it relates to messaging materials or in how we're thinking about maintaining a coverage pathway and communicating with people moving forward. Jen, let's forge ahead here. With regard to some of our privacy messaging, I did want to highlight that we've sort of continue to promote and highlight and circulate our talking points about privacy and the waiver. So you can see some of that messaging here. Namely, we're committed to, as we're seeing things evolve at the federal level, making that information available to people. So I'll show you in a minute the website that we'll have if there's an interest in bookmarking it or checking it. That's the same place that we put information about the DACA rule, kind of flip-flopping back and forth. We're also going to be putting information as we know it about waivers and federal gaze. We also, again, have just continued to remind people that, information on people who don't have a federally recognized immigration status is not shared. Identifying information is not shared. And for those of you who were with us during the public charge days, as of today, as of now, having health insurance continues to not count against you in any pathway to citizenship, or doesn't affect your immigration status. That's something that's flipped and flopped, and we'll certainly be watching as we move forward. But having Medicaid coverage and having qualified health plan coverage and accessing state subsidies is not something today that would impact your status or your application for citizenship in any way. The next slide just shows you where on our website that this information will be available. On our corporate page, we also have some of this information available in Health Plan Finder itself, but for purposes of stakeholders and external audiences, we have initiatives pages where we put key top-line information and messaging. So you'll see there's a spot for immigrant health coverage where information will be shared about the waiver and our privacy messaging. And there's also a Deferred Action Childhood Arrivals, a DACA tab that folks can access as well, where we're putting information about those lawsuits, and we'll put information about any federal activity we see there. Okay, so next steps. As was mentioned, I think by Manny earlier, I've been on a bit of a roadshow here. So with this, talking about the waiver and talking about our contingency planning and our high-level thinking around path forward. You can see some of the stakeholder groups I've been meeting with here. If a group that you're affiliated with is not listed here and you would like to be, feel free to reach out. The Washington 1332 emails at the bottom of this slide, and folks, of course, can also feel free to reach out to me directly. We've been gotten some good feedback that's informed our thinking about moving forward and further engaging with stakeholders on this topic. So again, being mindful of, one, not wanting to talk anything into existence, and two, there are just some nuances of creating a state level solution that we don't really want to poke the eye of the feds too strongly there as well. We're also in the 2025 legislative session, so have been working with Ingrid and Shirley and others who are engaged in our legislative efforts more directly about any kind of updates or changes we might need, thinking through what we might need to maintain a coverage pathway moving forward in the absence of a waiver. That looks like some of these privacy protections, that looks like potential increased authority to sort of help administer a state program. It also looks like potential updates to maintain funding and to make sure that our state subsidy that has helped lowering premiums for people who are undocumented stays connected to a new program and stays available to help lower costs. So those are sort of our top of mind immediate activities as it relates to session and continued stakeholder engagement through this month and next month. But again, welcome feedback on other activities that would be helpful and useful, and welcome feedback on additional forums we should be in front of soliciting feedback. I think, Jen, that's it for me. I think if we want to skim through the appendix slides just for posterity here, the next slide shows you, again, just links you to that DACA page I was showing. Happy to take questions about this if folks have it, but we're in a little bit of a watch and wait. There are some court cases that have impacted, they sort of swung the eligibility of DACA recipients around a bit and settled on no changes in Washington for the immediate future through the courts. But now we're waiting to see if there's any administrative activity through HHS or CMS on this. So again, as we know more, we'll be updating that website. And the next slide just speaks to some of the broader continuity coverage issues that we're watching for. We did see recently in the activities related to the Medicaid unwind. So there were changes at the federal level that let folks stay on Medicaid longer. We saw the Medicaid rolls go up. We saw the number of people turning off Medicaid go down. And then the federal rules went back to business as usual. And we saw a deluge of people come off. So we know that these eligibility changes at the federal level have impacts that are downstream. We also know, obviously, that there are disproportionate impacts downstream. So we did a recent look at people turning off of Medicaid as part of a legislatively mandated study, which is the links available here if people are interested in details, but probably unsurprisingly to everyone in this group. We looked at people turning off who was turning off of Medicaid and then who was showing back up over on the QHP rolls. There are 80,000, 100,000 people who are estimated by our colleagues over at DSHS to be turning off and not re-accessing coverage. And they did a really significant informative dive into who are the people showing up on the QHP rolls and who are the people who are ending up in the uninsured bucket or the likely uninsured bucket. And again, unsurprisingly, people who are AIN, who are Black, who are Hispanic, who are younger, who are homeless. These are the groups that you all work with. Those folks are the more likely to be uninsured than they are to be able to navigate over to our qualified health plan coverage. So again, good suggestions in there in some steps that could be taken to further facilitate people to coverage, but also good lessons there in terms of changes at the federal level impacting downstream state programs and downstream coverage transitions. So that's something we're certainly being mindful of as well. Manny, I'm done. Let the record show I'm done early. 3 minutes. I will yield my 3 minutes of time back to group discussion. And if it's helpful at all, Jen, we could roll the slides back and just at a high level tee up some of these discussion questions, or Manny, we could kind of work through them in order if you think happy to go wherever the group wants to go, or take us through the discussion questions that we sort of posed along the way, if helpful.
Thank you, Joan. What I would suggest is I already shared the questions on chat.
Brilliant.
And what I would suggest is that as people are interested in offering feedback and whatnot, to raise their hand so we can call on you. You can raise your hand over and over again. So if you shared some ideas about one area and then somebody else is sharing and you want to come back and speak on another area, that's fine. If you, the participants, if you just want to go one by one, that's fine. However, you as a participant feel more comfortable sharing, we'll take the time to go back to you as many times as we need to go back to, or to listen to you for as long as we can. Recognizing that we also have other people that want to share and that should have the opportunity to share. So Excuse me. So be mindful of the time that you use. Keep that in mind so everybody has the chance to share. And you don't have to. This is to the members of the committee. You don't have to just answer these questions. There might be other things that you saw or other ideas that you think that John and the team here at WAHBE at the Exchange can use in mitigating the impact of a possible of the waiver possibly going away. So we want to hear all the ideas. All the ideas are good. All the ideas are going to be considered. All the ideas are going to be examined, and those that make sense and that we can implement will be taken into consideration for implementation as well. So and keep in mind, I didn't say all the ideas will be able to be implemented. There are many ideas that we will be able to work with and implement, but that doesn't mean that we have a magic wand that we can do everything that we wish we could. So with that, Folk, I see that Lichi has her hand up. Feel free, people, to keep raising your hand. And I would ask, if possible, this is not a requirement, but if possible, when you come to talk, if you can open your camera. But again, not a requirement. It's just that way we can interact with you a little bit. But if you cannot or don't feel comfortable, that's fine too. So Lichi, see your hand first.
Thanks, Manny. And I apologize for being off camera. I am over 24 hours into a travel delay, so I think it's better for everyone for me to stay off camera. But I want to start off by thanking you, Joan, and everyone who helped secure and negotiate the 1332 waiver with the additional privacy protections. I think that coverage and maintenance of access, and to the extent possible, state subsidies for the 1332 population are really key, just because we know that there are dramatic affordability differences when people don't have access to federal subsidies. And we know that while it's fantastic, people can use their own money and people up to 250 can access Cascade Care savings until it runs out. The reality is those plans are just not very affordable for a whole lot of people. I would also say that I'd appreciate if you could share when you expect to have a sense of what you need from the legislature and to let us know how we can help, because I think that it is really important to make sure there's a pathway should the 1332 get pulled. And to the extent possible that the HB can strengthen privacy protections is really great. As reassuring as it is that privacy protections already exist, I think I personally am not very comfortable knowing 19 to 24-year-old hackers have access to my information. So there's that.
Yeah, Lichi, thank you so much. I heard coverage, access, state subsidies. I heard the sort of continued that support for strengthening our privacy protections at the state level. And then I heard the ask, and I really appreciate it, around legislative help, always welcome. I would say sort of over the next couple of weeks, we're sort of working with our implementation partners, and we'll be, sort of working with our leadership here at the Exchange on driving to the definite in terms of a proviso strategy and an implementation strategy. And to the extent that gets sort of ironed out, I think support for sort of general support for authority and updates we might need to be able to continue to offer a coverage pathway is certainly welcome. And I think even in the absence of specifics that just are highly technical and are taking some time to work through, general support of that concept, I think, would certainly be welcome. But I'll pause there and see if Ingrid or others have anything else to add there as well. And yeah, Manny, otherwise can sort of, we'll look to you to shepherd me through the rest. Some of us live that one screen life, Manny. I don't know. You tell me where we're going.
Yeah. Folk, feel free to raise your hand or unmute yourself. I don't see any other hands, but I know that we're all concerned about the impact of federal federal guidelines and policies on our communities, and we really want to hear your ideas, your thoughts, your suggestions. So I see a hand, Joseph Lackman.
Hi, yes, this is Joseph Lockman with Asian Counseling and Referral Service. I just wanted to echo some of the same concerns as Lychee. Again, just really want to, see an equity lens, especially, I mean, as part of, the guiding principles for in thinking about immigrant health coverage moving forward, especially with, threats to potentially to the 1332 waiver, and just making sure that, we're not ending up with, especially, affordability challenges for folks who are in some of the most, you difficult economic situations and trying to afford healthcare here. And again, with the health benefit exchange not being sort of, an agency that would fall under Keep Washington Working, just making sure that, we're getting updated on what, guidance is out there for HC and HB in terms of protecting information. And again, especially in light of, the concerns at the federal level about, what, I believe to be just unauthorized access, illegitimate access to sensitive data, just making sure that Washington has policies in place to, to make sure that everyone's data is protected. Thank you.
Thanks, Joseph. Good to hear from you, and definitely heard, I think, sort of top to bottom review of we sort of 2 years ago implemented these privacy procedures and have now seen sort of are in unprecedented times as it relates to data access and security. So definitely one area that we'll also be leaning into is just, again, sort of continued communication with the sisters. We know among this waiver population, 75% of people are working with an assister, predominantly navigators, to help them navigate our application and get enrolled in coverage. So navigators will just continue to be a key resource for us in terms of communicating what privacy protections are in place and how we're continuing to work to strengthen them. And then we'll definitely relay back to our folks here working with the governor's office and the attorney general's office on Keep Washington Working and expanding the applicability of that law, explicitly tying it to the exchange, certainly on our radar and something that's being actively discussed. So we'll be able to provide updates on that, I would hope, sometime soon.
Oh, excuse me, we have half an hour to go. So, and this was the conversation. This is the presentation. This is the theme that we want feedback on. So we have plenty of time to hear all of your concerns, all of your ideas, all of your feedback on the contingency plans. So feel free to unmute yourself, to raise your hand. If you
Manny
feel
and
more
Jen, I was
comfortable
also
sharing,
hoping, oh, sorry, go ahead, Manny.
if you feel more comfortable sharing on chat, please do that too. Yeah, go ahead, John.
Jen, is it possible to scoot through the slides to the slide with the forums, the presentation forums on it? I can tell you when. Go ahead. Sorry, I took you from one end to the other here.
Okay.
But just one prior. You had it. Right there. Perfect. Under next steps. Yeah, thank you. So I think, again, just wanting to sort of confirm and make sure with this group that this is the right list. Many of you probably heard me, whether at a Navigator Lead Org meeting or First Friday Forum, or as part of the Health Equity for Immigrants campaign, invited there and invited back in the coming weeks, or as part of one of our various technical stakeholder work groups. Patricia, I know, been working with DECA on community health centers, and if there's an appropriate additional forum that we should be part of there. Obviously you all here as part of this committee and eventually our board, also are the Association of Washington Health Plans. It's, our carrier partners are a key part of whatever we would be implementing, in addition to state agency partners. So again, to the extent that there's interest and or other forums that there's an interest in us coming and engaging, would welcome the group's input and thoughts there. And if y'all are sick of me by now, that's welcome that feedback as well. I'm also seeing the question in the chat about sharing the information presented today with organization communities, or should we hold off for now? I really appreciate the question. I would say the slides that are public and are publicly available for this meeting, I know we'll be posting this updated version of the slides on our website. So circulating the slides that are going to be available, sort of the updated version that are going to be available on the website, we would welcome. I would sort of just be mindful of the distribution networks and how far and broad, but certainly everything presented today is public knowledge. With regard to recordings and transcripts, would appreciate people exercising a lot of discretion and or a very limited distribution of those types of materials.
Joan,
Excuse me. And to expand a little bit on what Joan said, and going back to the introduction of this part of the conversation, it is a difficult balance, right, to keep our community informed, especially those that we engage more constantly and that we want to hear from, while at the same time not calling too much attention to the fact that we have a waiver to provide access to undocumented residents to a healthcare plan. So I would say, use your judgment on how much you want to share from what is publicly available. Keep in mind that on the one hand, we want to continue providing access, while also we don't want to call too much attention from the federal government. And right now, it's a little bit difficult to not get attention from the federal administration when you're doing something that goes against the principles that they're trying to implement. So keep that in mind and use your judgment on, protecting the community always should be our priority, the protection of our communities to have access to these products. Yeah.
Manny, seeing two
Someone
things
was
in
saying
chat
something?
that I can pick up on if that would make sense. One
Yeah.
was a good question around have there been any discussions about how the exchange and healthcare authority would go about communicating possible changes in healthcare access, either from sort of an administrative rulemaking perspective, or if there are changes or termination of the waiver. I would say yes, we're at the beginning stages of planning for that and would welcome additional feedback or thoughts there. The typical communication channels we use when there are changes at the federal level that impact our customers, it's sort of multi-tiered. There's sort of the direct outreach that we do to impacted customers with instruction and guidance about what people need to do, if anything, by when. And then there's sort of a level of communication that goes to assisters, particularly assisters who are partnered to people in impacted communities, to, again, provide instruction about, what the change was, provide some additional context about how they can best serve the customers. And then we have these websites, both Health Plan Finder and our corporate website, where we will typically flag or highlight at a high level if there's an action a customer needs to take, and or if there's some top line messaging associated with the change that we want to make available, we do that there. So between sort of those corporate links that I provided, where we'll be putting updates when we have it, and then the newsletters and the assister messaging that goes out, and then the direct to customer communication, we also, to the extent that something broad happened with the waiver, we have a fairly robust 1332 waiver listserv, and then we also typically send that messaging out to relevant committees, which you all would be a part of. And then we get on rooftops. No, I'm just kidding. And then we do our best to sort of get what we can to impacted folks and the communities that serve them as soon as possible. But we'll certainly be working with our comm shop on a more detailed communications plan as well. Haven't quite gotten to
And-
the comms part yet, but working on it. The other thing I noticed in chat was Lychee, the comment, the wish list comment about addressing cost sharing disparities for people under the 5-year bar. So for folks on the call who may not be as in the technical weeds, there are populations of lawfully present immigrants who are unable to access certain Medicaid programs while they're in the 5-year bar. The first 5 years that they're here, a clock starts ticking, and then once you get to the end of 5 years, you're eligible for some of the federal Medicaid programs, but you're not until you get to the end of that 5 years. Those people who fall into that category, affectionately known as the 5-year bar, can come to the exchange and they can get qualified health plans with federal subsidies and with available state subsidies. So the sort of when you're lining up sort of the coverage someone can get through Medicaid versus the coverage they can get through the exchange as it relates to affordability under the Medicaid program, zero premium, zero cost sharing for most folks under the qualified health plan, particularly for the lowest income folks who might be in the 5-year bar and otherwise ineligible. You get your subsidies that typically cover the cost of your premium. And then you have your services with no cost sharing in a Cascade Care plan. And you get services before the deductible, but you do typically have an out-of-pocket maximum of a few $1,000s that you need to hit. And it's that cost sharing disparity that Lychee, I know we've talked about, and I think is of interest, which is, is there a way to even the playing field there so that if you're someone who can get coverage under Medicaid with no premium and no cost sharing, and you're someone who can get coverage in a qualified health plan at the same income level with no premium and limited cost sharing, is there a way to address that limited cost sharing piece? And the answer is usually yes, and it's usually that it just costs a lot of money. And those two answers have been true. But anyway, happy to delve into those details more if of interest. What else, Manny?
There's another question from Patricia. And Patricia, were you the person that I cut off when I started talking? I think that I cut someone off, and I want to make sure that I'm giving space to everybody.
No worries. I was just wondering, Joan, if there's any concern about any changes to the Navigator grant?
Patricia, can you tell me which grant or just funding in
Oh,
general?
I mean, like the money that the exchange gets.
Yeah, that's a good question. We currently receive general fund state funding to support outreach to the immigrant health communities in support of the waiver and in support of the Apple Health expansion. We don't know when we're doing outreach to someone if they're going to land in the Apple Health expansion or they're going to land over in our shop. But our outreach team receives $700,000 over the last 2 years, each year to do outreach. So some of that funding we've used to kind of help support and bolster our Navigator networks. Some of that funding, half of it this year, we put directly into community-based grants that went to local community orgs working within immigrant communities. And then some that goes to sort of a multicultural, like a multilinguistic consultant group that we have that's helping us build the base materials and helping us translate them into 20 plus languages that we use to try to reach as many diverse communities as we could. So right now, that was a decision package we wrote when we applied for the waiver to get some funding to support the waiver and implementation of the waiver. Patricia, the hope would be, so it's general fund state dollars. We're in a constrained budget environment. So I think there's always a little concern there. The hope would be if the waiver got pulled and it were replaced with a state-specific program to serve the same population that would be accessed, via the exchange and navigators and other groups, that funding would transition with that program and hopefully be able to support continued outreach. So the hope would be to retain it since it'd be the same functions for the same population, just as part of a different program.
Thanks, Joan.
Yeah. concerns. I have the same concerns about that grant that I have about every general fund state dollar coming to the exchange right now. But beyond that, I think we could make a good case.
And it's a good thing to remind people that we are in well, Washington is in a difficult fiscal position right now, and we don't have control over, the budget. We have control over how we present our arguments to ensure that the funding that we request for the work that we do is clearly communicated to our legislators, and that's all that we can do, right? And then we keep monitoring and ensuring that that we have as much information and as accurate information as possible so we can communicate with our community as things are happening. And yeah, we're in a difficult position right now, and we don't know all the things that are going to happen, but we will have more clarity in the coming weeks as the legislature takes on the budget conversation. So yeah.
Manny, speaking of the budget situation, I will also just say, and I mean, it's rare you get to call out your boss. So Leah, I will say your name in anticipation of calling you out. And again, I'm not sure that it's for here, or Manny could certainly be a topic that we bring back to this group, but I have very talented colleagues in the Office of Strategy and Policy Shop working on the question, Joseph, in chat around how we're addressing the end of the enhanced premium tax credits. So people up to 400% of the federal poverty level who are attest to being a citizen or are lawfully present are able to access federal premium tax credits that significantly, as Leachy mentioned earlier, significantly lower the cost of their premiums. We also have a state subsidy that's available to both people who are federally and non-federally subsidized that helps pick up after those federal subsidies are applied. During COVID, some federal legislation passed that boosted the amounts of the federal subsidy. It extended it way beyond 400% of the federal poverty level up to more middle income levels. And it also boosted the federal premium tax credit for the lowest income folks. So you sort of saw a collective increase in the amount of federal financial assistance people were getting to buy health insurance. And as a result, we have seen tens of thousands of more people sign up for coverage through the exchange, because when you make it more affordable, more people can afford to buy it. So now at the end of 2025, the enhanced premium tax credits, the extra boost that we got several years back now is set to expire. And so folks in our policy shop have been working really hard in partnership with, having discussion again with legislature and others around if that enhanced dollars go away, are there ways at the state level we can help mitigate some of those federal financial losses? It is hundreds of millions of dollars. It is an amount that the state on its own can't fully backfill. But there are some state level funding that would help, and there are some mitigation efforts that would help. And so we'll pause there and just see, Leah and others, if there's anything else to mention at a high level here, or best left for another day. And Joseph could come back and help address it as well.
Happy to come back another day and help address it. Just at a high level, the things that I would add is our actuarial analysis estimates 80,000 people will drop coverage without the enhanced subsidy. Represents about 275 million into the Washington residents in terms of their tax credits. The actuarial analysis also indicates that up to 10,000 of them would maintain their coverage if Cascade Care Savings is maintained at a funding level that would support the current distribution. So as you all know, it's a very difficult budget session. We'll see if that happens, but we're providing that level of technical assistance. Also on our website, there are materials including statewide impact as well as impact by congressional district, because it changes a little bit depending on multiple factors that impact how much tax credits you get. I'm happy to put that in, a link to that in chat, but you can look at any of those materials. If there are data that you all need and we have available that helps you in understanding the communities you serve, we're happy to provide that. And if there are other forums where we can provide that kind of technical assistance or information about impact, we're happy to do so. That really doesn't address mitigation. That's really getting the word out. You know, again, we're not going to be able to fill that entire amount, but maintaining Cascade Care savings feels more important than ever. So that is one area of focus for us. And then we're just looking at all other policy options that might help either maximize Cascade Care savings, maximize the state subsidy, and then we'll be turning, you know, very shortly to how we prepare for that. Happy to come back and kind of go through several of that work, if helpful to folks.
Thank you, Leah. And very important to make the clarification that the population that we're talking about today, the immigrant, undocumented immigrant residents in Washington, do not qualify for these subsidies and tax credits. That is two separate conversations. So I want to make sure that we continue focusing on the conversation today, which is the waiver and how to mitigate the possible the revoking of the waiver. So and we will certainly I mean, what I hear is the interest in having a conversation, a more in-depth conversation about contingency plans for the enhanced premium tax credit. So we'll probably do something, excuse me, in our next health equity TAC, some conversations about that. So I see, Lichi, you have your hand up.
Thanks, Manny. I actually want to return to a comment you'd made previously about our difficult financial position in Washington. I think we all know that OFM directed agencies to complete a cuts exercise and indicate where an additional 6% of cuts beyond Inslee's outgoing budget would come from. And I am curious what HBE can share about what cuts were suggested in your shop, and especially interested in things that may impact the conversations we're having today.
Joan called her boss. I would call my boss. I think that Ingrid is still here, and I don't know if Ingrid, if you feel comfortable sharing very high level on that, and you're on mute.
Yeah, no, I got it. And I'm sorry, I'm so backlit, so my image is hard to decipher. Lichi, thank you for the question. We can get a more specific answer. I just need to pull up a document, but the short answer is because if you look at the funding, the funding pie, if you will, or the proportion of funding that we get at the exchange, we have a high percentage of federal funds as well as funds that are generated through the carrier assessment and through the premium tax, so that those are the two largest sources of funding for the exchange. The slice of our funding pie that is state general fund is relatively small. Therefore, having to reduce a percent of that is a much less heavy lift to us than state agencies that are much more highly reliant on a state general fund. So for us, we will be able to achieve, we have put forth that we have not put forth suggested cuts to Cascade Care savings, which goes directly to our customers. We feel is an essential service that needs to be continued, which does receive general fund. We are able to access the savings reduction target through other sources of administrative savings that we will be able to achieve without touching funds that go directly to our customers. That's the short answer, and I'm happy to get more detail if needed. Thank you.
And Ingrid, that includes funding for that we discussed earlier to the immigrant health coverage
Correct.
group as well.
So
the waiver population wasn't impacted by that as well.
Yes. So all individuals eligible for Cascade Care savings, including those who are not eligible for enhanced premium tax credit, none of that would be touched through the proposed reductions that we put forward for that exercise.
Thank you, Ingrid, and thank you for answering my call. I didn't want to be the one
Manny, we've each choose
having
one.
that
We've each choose the
conversation.
one for our bosses now. So we're
That, yeah.
out. I mean, I
Yeah.
am
I
seeing
mean,
something in chat from Aaron, and
I did have the information obviously, but having Ingrid here, I think that it was the right thing for her as our CEO to share
Agreed.
that the good news actually that we didn't have to present any funding cuts to services. So that was I think that it was a news that the CEO should share with with
Each
the
of our
committee.
phone a
So
friend lines has now been
yes.
expunged. Aaron, you asked a good question in chat that I also just wanted to highlight for the broader group around. The comment was that if there are changes, it would be very helpful for us to clarify which state programs are still in place and which aren't, because there's often confusion between state programs. And I will amplify and echo that. I think the average customer doesn't necessarily know if they're in customer surveys. It's demonstrated folks don't always know if they're in Washington Apple Health or in a qualified health plan or in a qualified health plan with tax credits versus a premium the chip program. So I know we know that there's confusion. And I think it's a point that's really well taken. There are lots of coverage programs that impact people who are undocumented, including state-only programs on the Medicaid and Washington Apple Health side of the house. And for the waiver, it really is limited to that 2,000 or so people who are accessing qualified health plan coverage through the waiver, who we would be looking to transition to hopefully cover through a separate and distinct state program. Rather than the whole cadre of programs that exist that serve people who are undocumented more broadly, administered by our friends over at Healthcare Authority. So points really well taken, and we'll have to make sure we're really clear there.
Thank you, John. Erin, I see that you have your hand up.
Oh, nice. Aaron, did I help
so-
or hurt the cause?
You helped. So I love what you said. And there's also confusion that is just broad everywhere. So, like the Commission on Hispanic Affairs has put some resources on their website, for example, but people will not qualify for a state program. And then they feel like, oh, I don't benefit from any state program because you've got DSHS, you have all these other things. And the fear is so high is that some people are disengaging more broadly, not because there's such such complicated rules under everybody. So just caution on overarching communication.
Super helpful. And we've also I will say we are going to start pretty closely monitoring for folks who just came in during open enrollment. If there's always a little bit of a drop off as people go through their coverage year in terms of retention, but we will be sort of closely watching too to see if I know there are some programs that have reported people dropping and or reduced utilization of services, and we're hoping that folks are able to maintain their coverage and obviously are able to find enough value in their coverage that it's worth maintaining. So hoping for that, and we'll be keeping an eye on that as well.
Folk, we have 3 more minutes of, excuse me, this conversation, and I want to make sure that everybody's voices have been heard. If you have some ideas, some feedback, some thoughts on the presentation that Joan offered us. So, are there any other comments, especially from people that haven't taken the time to share their thoughts? And also, if you want to continue the conversation, you can reach out directly to Joan or me with your thoughts, with your ideas, your feedback. But I wanted to make sure that people had the chance to share here. So, any other ideas? Any other members of the committee that want to share? And I also want to say we will move into public comments after. So if you're a member of the committee, you're more than welcome to share now. If you're a member of the community that is attending the meeting, we'll open some time for public comment in now 2 minutes. So other members of the committee that have ideas, feedback for Joan. very quiet today. Anyone? And if anyone is speaking, they might be on mute because I cannot hear anything. So keep that in mind. Hey, Lichi, yes.
If no one else has a comment, I just wanted to thank you, Ingrid, and everyone at the exchange for preserving benefits for people. It is helpful to know that HPE is in a better position to do that, and we have a lot of work ahead of us across the board. So.
Manny, if I can say thank you, Lichi. And in addition to that, the issue of the budget reduction exercise, I want to make sure that we get out to everyone on this call our fact sheets and materials, both on the federal enhanced premium tax credit. We have it. We will send you the link. We have a blog about it, a statewide fact sheet, and fact sheets specific to each congressional district. We also have a really good 2-page fact sheet on Cascade Care savings, which will be essential and important and very relevant to this conversation. So we'll be sure to send you both as follow-up. Thank you.
Thank you, Ingrid. And as always, if anyone, any member of the committee or member of the community has any questions or any needs more clarification on anything, or any of the themes that we have talked about today, feel free to reach out to us. Feel free to reach out to me. I'm more than happy to provide some more information. And to the extent that we have it. And we also know that it's a very confusing time right now. And it happens in every transition. So I don't want to say that this is necessarily unique. It's unique in terms of the type of changes that are happening and the type of policies that are coming down from the federal government. But transitions are always difficult and confusing because new administrations come in and are learning about what they need to do as well as how they want to implement their agenda. So they're always a little bit confusing. So don't think that this is unique. It happens every 4 years, regardless of what the transition is. With that, we are opening the time for public comments. This is a public meeting, so the public is invited to submit their comments. I don't know if we received any written public comments, but if there's any member of the community, people who are not members of the committee, but members of the community who are taking part of this conversation and want to share their thoughts, their ideas, their feedback, or just have a general comment, you are welcome to share those now. You can put your name on the chat, or you can raise your hand or open your mic and feel free to share your thoughts with us. Any member of the community who wants to share any public comment? And last call, any community members who are on this call who might want to share any comment regarding what we just shared in the presentations, or any general comment for this committee? Okay, well, thank you, everyone. So as we wrap up, excuse me, does anyone from the committee want to share final thoughts or anything that you might want to share before we close the meeting? Okay. Well, folk, thank you so much for attending this meeting, for making time. And I saw that some of the people that were not at the start of the meeting joined later. Thank you so much for joining. I made sure that I mark you as present at the meeting. So thank you so much. I want to remind the members of the committee that the next meeting will be in April, April 9th from 1 to 2:30. And if possible, we're gonna try to make this a hybrid meeting. So start thinking about the possibility of being in Olympia with us for that meeting on April 9th. and it would be great to connect in person if it's possible. And yeah, we'll provide that space for a hybrid meeting. We will have obviously a virtual option as well, but start thinking about the possibility of being in Olympia with us on April 9th. With that, thank you so much. I hope that you have a wonderful rest of the week, and thank you so much for all the work that you do with our communities and for our communities. Okay, bye.